Hi, I'm Sammy Chen. I am a student pharmacist who will be doing a nasal swab collection today. So first, I want to make sure that I have the proper supplies, and today I have with me a sterile cotton swab. Okay. Next, I want to make sure that I am wearing proper PPE. So since I am doing a self-demonstration, I am just wearing professional clothing. But depending on the setting, I'll wear something different. And next, I'm going to evaluate my patient, and I'm basically going to ask them if they had any surgery recently to their nasal passage. If they say no, then I will continue with my demonstration. Next, I'm going to tell them what to expect from this. I'm going to say that I am going to insert the cotton swab into their nose and to get a sample, and that it might feel uncomfortable and they might feel some pressure. Okay. Next, I'm going to sanitize my hands and use proper precaution. Okay, next, I'm going to position the patient in a way to make sure that I have easy access. I'm going to keep eye level with their nose, and I will ask them to look straight forward, and also ask them to close their eyes. Okay, next, I'm going to look at their nose to see if it's deviating in any direction, and just to look in their nasal passageway. If they do happen to have a deviated nostril or anything that's blocking it that will make me difficult to get the sample, I will just use the other nostril first. Okay, and if they don't have any deviation, then I will just use the nostril with the most secretion, so to get more sample for my first swabbing. Okay, now I will be doing the anterior nares collection method. So first, using my dominant hand, I will be holding it between my thumb and my first finger, and I'm going to insert the swab at least half an inch deep, and I'll just leave it there for 10 to 15 seconds while rotating it. And then I'm going to do the same thing to the other nose. Okay, so I'll be demonstrating it now. Okay, so I'm going to insert it half an inch for 10 to 15 seconds while rotating. Okay, now that I'm done with that side, I'll be doing it to the other nostril. Excuse me. Now that I'm done with that, I will be placing it in the proper transport media so that it can be stored properly and be tested. Thank you. That will be the end of my demonstration. Hi, I'm Sammy Chen. I am a student pharmacist and I will be doing a buccal swab. So first, I want to make sure that I have the necessary supplies, and I have with me a sterile cotton swab. Next, I want to make sure that I'm wearing proper PPE, and it depends on your setting. So since I am doing a self-demonstration, I'm just wearing professional clothing. Next, I am going to evaluate the patient, and I'm just going to ask them questions like, have you had anything to eat or drink in the last 30 minutes? Or if you have used any nicotine products in the past 30 minutes, or if you brushed your teeth or used mouthwash in the past 3 hours. And if they say yes to any of these questions, then I will let them know that they should wait for better results. Okay, so next I am going to tell the patient on what to expect. So I will tell them that I'm going to insert the swab into your mouth and collect a sample from your cheeks, and it shouldn't be uncomfortable at all. Okay, and then I'm going to sanitize my hands and use proper precaution. So first, I want to position the patient in a way for me to have easy access to their mouth. So I want to maintain eye level with their mouth, and I will ask them to look straight ahead and also encourage them to close their eyes. So now I will use my cotton swab to demonstrate. So I will tell the patient to sit still while I get the sample. And using my dominant hand, I will insert the swab into the mouth and firmly rub it up and down on their cheek for about 5 to 10 seconds. And then after that, I will repeat the same thing to the other side for 5 to 10 seconds. And when I remove the swab, I want to make sure that I am not touching their lips or their teeth to avoid any contamination. So now I'll be demonstrating this. Okay, on my dominant hand. Okay, now on the other side. And now I will place this inside a transport media so I can store it and so it can be tested. Alright, thank you, and that is my demonstration of a buccal swab.